The prostate gland itself is a small gland that sits right beneath the bladder and in front of the rectum. And again, it's something that is only within men. And the function of the prostate is to basically help produce liquid that goes into semen. And so it's really a reproductive organ that men really only use during their reproductive years. But unfortunately what can happen is that the cells that make up the prostate gland can, over time, as a man ages and depending on certain genetic influences, some of those cells can turn cancerous. Prostate cancer is a major public health problem in the sort of true sense of that term. It's exceedingly common. If you look at general statistics, in a man's lifetime, it's about 1 in 6 men throughout their lifetime will contract prostate cancer or be diagnosed with prostate cancer. In the year 2012, the sort of cancer experts in the country are expecting somewhere on the order of 240,000 cases of prostate cancer throughout the United States. The cure rate of a man diagnosed with stage 1 or early stage prostate cancer can be 90 to 95%, whereas men who are diagnosed with stage 3 prostate cancer, the cure rates are only around 20 to 30%. And unfortunately, men with stage 4 disease have cancer that has spread in the body and they are not cured. So when it comes down to the discussion of the treatment options for a patient with newly diagnosed early stage prostate cancer, there are really 3 different treatment approaches that one could envision going through. The first is active surveillance. The second is surgery, which is usually what's called a radical prostatectomy. Or third would be radiation therapy in its various forms. Many patients with prostate cancer, when diagnosed at an early stage, have such a low-grade disease that it's not thought that their disease is immediately threatening to their life. And in that case, simple observation, or what we like to call active surveillance, can be undertaken in an effort to delay the need for treatment and to also avoid the side effects of treatment. So this is a really exciting time in the field of prostate cancer medicine, largely because of a number of new technologies that have recently come out on the market. When you are talking about early stage prostate cancer treatments, there's exciting new surgical options that are minimally invasive, including the robotic prostatectomy. With regard to radiation therapy, the advent of brachytherapy or radiation seeds that can expose the prostate gland internally to radiation has really revolutionized the field and has really cut down significantly on the side effects, both short and long term, of radiation therapy. And for patients who have more advanced disease, where their disease may not technically be curable, some really exciting recent advances are allowing us to significantly extend those patients' lives, often by years, with hormone therapy, a number of different bone protective therapies, chemotherapy, and there's even a new exciting vaccine therapy that we have available. So really, at really all stages of disease, we have new and exciting breakthroughs that are really pushing the survival of patients with prostate cancer much longer than we've ever seen before.